So now that we've talked about different types of different ways that you can, where to look, et cetera, now let's figure out things that we can do to fix your lumbar spine. Okay, there's a few major things, all right? So fixing the lumbar spine, almost always, not 100% always, but you know what I mean. So what do we want to do? What do we want to do? We want to get the spine moving. We want to get it decompressed. We want it moving. We want it moving fluidly. We want it as aligned as possible, and we want it decompressed. All right. So what you need to make sure you're keeping an eye on when looking at low back pain. I've done this in other videos, but I'll tell you about this again. So you have muscles in here called psoas muscles, which are deep hip flexor muscles that will actually pull your lumbar spine forward. It'll actually pull it this direction and put you into extension. So it'll cause a potential lot of pain back here in the facet joints. Also too, it could cause a lot of pain back here in that disc, in the posterior disc. So it can cause, again, blah, blah, blah. It can cause all those facets, right? So make sure your hip flexors are long. If your hip flexors get tight, it pulls you forward. It pulls you this way, which causes a lot of damage in that posterior aspect of the vertebra and that posterior aspect of those vertebral segments. Also too, you want to make sure, because you have a right and left, you may have a tight psoas on the right or a tight psoas on the left, which can pull your spine this way. All right. So we want to make sure that we're balanced through those, again, psoas is going to be those hip flexors. All right. So we want to make sure that we're balanced through those hip flexors. That'll help your SI joints move better as well. Let's see here. Also too, glute strength. So your posterior sling, so your glutes and your hamstring, what they are going to do is they're going to help to, in theory, they're going to help to pull all this down. So if we can pull that tailbone down, what it's going to do is it's going to keep that from getting excessive extension, which a lot of us have because we're tight in the front. We're tight through here in these muscles, the hip flexors, the quads, all that. We're very, very tight in the front, which pulls us forward. So we want to become looser in the front, stronger in the back. And then we can, if you can create some strength in your abdomen, but not just doing a bunch of curl-ups, because all that's going to do is destroy your spine because you're just smashing all these discs in the anterior portion. So you don't want to do sit-ups and crunches. Whole nother video. So we want to open up the hip flexor, very specific hip flexors, and we want to strengthen your glutes and we want to strengthen your hamstrings because it's going to pull you here. It's going to open that up, and then that's going to open up even more by loosening up the front. All right, so then we're loosening up the front, strengthening the back. It's going to take that pressure off of these facets and those posterior discs, and it's going to allow you to move more fluidly and allow you to move better. If these are tight, then you're going to get a lot of that motion. When you're doing different things, you're going to get it from your spine. If you get that motion from your spine, that lumbar spine doesn't like to move a lot. It likes to stay pretty sturdy. That's why you have so much muscle around there, so much fascia, so much connective tissue, etc. And so what we need to, you have to strengthen that core, obviously. Everybody knows that, but also too, you have to make sure that it can move and move freely, but just the minute amount that it wants to. It doesn't want to have to make up for tight hips. So strengthen or stretch your hips, open up your hip flexors, strengthen your posterior sling. That's going to help to take a lot of pressure off of that spine.